It's wild, it's twisted. Headlines hitting like a slap and you missed it. It's madness, I'm tapped out, live on the scene and I can't find my way out.
And welcome back to the Convoluted Podcast. It's your host, Jesus, aka Tyrant Dominus. I'm here with Liz.
Hey.
And this story shifts away from the shock and controversy and into something quieter, but no less serious. A recent study has found that pharmacists and pharmacy techs face a significant higher risk of suicide than the general population, raising urgent questions about burnout, responsibility, and how much strain healthcare workers are expected to absorb without breaking.
Before we get into the numbers and studies, I just want to say this up front. Pharmacy is one of those jobs that everyone thinks they understand, and they absolutely do not. People think it's counting pills and slapping labels on bottles. And yeah, we do that while answering phones, fighting insurances, calming down someone who's been waiting for 40 minutes, catching mistakes that could literally kill someone, and doing all of it unidentified, understaffed. There's no reset button, no breather between patients. We mess up once, and that's someone's life. But if the system messes up, that someone still becomes your fault. So when I saw the study, I wasn't shocked. I was tired. I was because this is just was a week, people, but it's about a system that grinds you down quietly, and then act surprised when people break.
So, that is a strong statement. All right, I'll start. A study conducted by the researchers at the University of California, San Diego, found that pharmacists and pharmacy technicians experience a significant elevated risk of suicide compared to the general population. The study examined occupational stress factors unique to pharmacy work, identifiable chronic workload pressures, long hours, understaffing, and the high responsibility with limited control as key contributors. Unlike many other healthcare roles, pharmacies are expected to maintain consistent precision while managing uninterrupted patient flow, insurance disputes, and regulation compliance, and frequent public hostility.
In recent years, the scope of pharmacy work has expanded dramatically. Pharmacists and technicians are now routinely responsible for administering vaccinations, providing clinical consultations, managing medication shortages, and navigating complex insurance systems, and often without corresponding increases in staffing pay, or institutional support.
Researchers emphasize that the elevated risk is not a reflection of individual vulnerability, but rather a systematic occupational strain. Errors in the pharmacy settings have had severe or fatal consequences, and the emotional burden of that responsibility is compounded by workplace cultures that prioritize speed, efficiency, and over recovery time and mental health.
Finding aligns with the broader trends across healthcare, where burnout, moral injury, and depression have surged, particularly in roles that combine high responsibility with limited autonomy. Despite why being labeled essential, many pharmacy workers feel invisible within the healthcare system. Notice only when something goes wrong.
So, this is a topic you wanted to bring up because it affects you and the people around you. Do you have anything to kind of continue beyond the statement you said earlier?
Yeah, it is absolutely true. I think nobody realized how essential we are. And even though you might go and get your drugs delivered, drugs or from the pharmacy, you might walk up to that person, but you give them the hardest time of their lives. They're already stressed out. You got phone calls going off the wazoo. Management is telling you need to have X, Y, and Z of flu shots this week. Um, all right, they're sitting behind their cozy desk. And again, shortages. It is so prevalent, especially at the beginning of the new year. I have dealt with several of them, and I still portraying now. antibiotics, stuff that you would not think you need, but you do. It just there's so many of them, and then trying to figure out where you can get it from, where you can locate it. I feel for them. I absolutely feel for the retail establishments, and I think it still plays to pharmacy and hospital staffings. Nobody realizes what I do. It's not when I deliver that medication and go, why did it take so long? Well, the IV technician had to scrub in and draw it up and you know, we have to make pictures and make sure that it's verified by the pharmacist before we can even, you know, comes out of that hood. I mean, like,
Yeah, because
I
at
don't
the
know
end of
why people don't think about how many steps there is. We have to make sure there's no any drug interactions with what you're currently taking to, or we have allergies. I don't know. Are you allergic to an antibiotic? Oh, so we're just slapping a label and giving it to you, and you don't care if you're allergic to it. Got it. It's like nobody thinks about these little things. Oh, you're taking this medication, has an interaction with this medication, but you want to take this medication? Are you still going to continue taking this medication? There's so many things at play. I don't think anybody realized how biologically and chemistry related it is to somebody's physiology. It's so many things going on. There are so many things at play, and people don't realize how big of a thing we are. We are constantly drained. You got the phone ringing. Again, I'm going back to this. It's constant every day. Phone ringing. People at the counters. People yelling at you. Why am my medication ready? Just it's one pill. Put a label on it. Stop it. Go. Okay. Well, what if it kills you? No, you don't care. Then what's the point of us doing it? Our jobs. I would just let you just pick a bottle off and go, oh, today's the day I'm taking this medication. This is going to work fine. No, no, there's a lot of things at play. I don't think anybody realizes how detrimental it is to your life, how much of a role these technicians do and pharmacists do. Our technicians are helping support the pharmacists. The pharmacists are doing the hard work and the leg of the running all this stuff. We're the ones who input it, count it, double check everything looks right before giving it to the pharmacist who verifies multiple things, verifies it against your profile and everything. Why I don't understand why people don't understand how traumatic it is for somebody to not realize how detrimental it is. So we think about you guys' lives. They tell us, they train us. Think about it. This is your family, your brother, your your best friend. Do you want them to be harmed? No. You are absolutely trying to save everything to keep them alive and thriving and, being a part of the human race. I don't think anybody realizes how hard it is sometimes. And you guys give us so much shit and so much slack and you're just counting bills and putting in a bottle. Count by five and go. Okay, yeah, sure. I want to see that. Let me see you do our job. Getting our certifications and having to renew them every 2 years and keeping up with the CEs, the continuing education credits. I don't think anybody realizes how expensive it is to keep those up too. I I don't think anybody realizes how hard it is. And I mean, every job's hard. I don't think anybody should ever say that about any job, but like, oh my God. Every day, Like this week alone, the 2 stations went down. Guess who was running? I'm the only runner in the pharmacy. There's 3 technicians on staff, maybe, if we're lucky. I got 2 actually. It's 2. And one person's in the IV reading, I'm the running. I'm running those medications. I'm taking those cartfuls of medications up to the floor. I don't think anybody realized how important we are. I don't think anybody I don't yeah. Again, I stress it so much and I feel like I'm redundant and repeating myself, but I feel it's so important to realize we're not robots. We're not AI. There's nobody who can do our jobs. I don't see robots running.
Actually,
You see them running?
they're working on that actually right now.
I know they are. They're trying to work on that, but I don't think that's
Just give it a couple of years. Give it a couple of years. But you're not wrong. You're not wrong. At the end of the day, the layman person, not lame, but the layman individual, the average Joe, just thinks that you're just counting pills, slapping a sticker, and you're good, right? There's a lot to, when it comes to medication in the medical field, there's a whole scrutiny of procedures and redundancies that had to be done to make sure, one, hospitals aren't held liable once the thing goes from that, right? Nobody wants any malpractice. So they go through these lengths to do that. But like you said, like I said, like people just think it's like count to 10, give your pills, slap a sticker, you're good, right? That's the average day. And that's just the work day. On top of that, not only just the work, but also the kind of the work environment. You talked a little bit about understaffing. The study talked about understaffing, poor staffing. You've talked about it all last year in the podcast. So if you want, you can hear Liz literally complaining through episodes of poor staffing. And that's just not even just alone in the medical field. It's just like everywhere too. So if it's hitting everywhere, it's also hitting the healthcare system. We've heard and read stories of nurses, doctors throughout the entire world these last few years of going on strike, leaving. So that alone, just that specific sector, that specific field is already suffering. So it's understandable, and it makes sense that when just kind of pinpointing this specific field of pharmacy and pharmacy tech and talking about this very, what many would consider dark topic, is something that should be talked about, because a lot of people like would brush this under the rug. That's the word, the rug. Thank you. And it's one of those things like that. People are suffering, and sometimes, like you've worked a ton and multiple times, so we've talked about this. Sometimes we fail to record a couple times because you just have to, you're go. And if it's we using you as an example, it's like you give, for the most part, you give yourself time sometimes to rest and collect yourself, but not a lot of people do that. And that's another aspect of this, is like finding that work-life balance to kind of, what's the word, cool you off or bring you down. I don't know what's the word.
And reset, basically.
Reset. And kind of just stabilize you from all that hecticness that the work is putting you through, right? Because work should just be at work, home should be at home, right? All the stress from work should just be stuck over there, and once you're home, you shouldn't be thinking about it. But sadly, we have to work to survive in this world. And we have to get up and go to work every day, 5 days, 6 days, some people 7 days a week. It is a sad truth. And if you told me that this study was done and how high the percentage was, I would not be surprised. Even after we finished reading it, talked about it, and I looked into the articles a little bit more, it is not surprising. And mostly how the current
it's women technicians, higher risk. Did you see that?
Yes. Oh wait, did this the summary not include that?
It specified numbers.
Oh, it wasn't added to the summary, but
because we care so much. You know, as a mom, you think about that kid that you're trying to save, and you're thinking about, that, that other parent, you think about it, and it's sad. And to see that numbers, those numbers were right there in the beginning of that article.
Oh, give me a second. I'll pull the main article.
Yes.
22%. There it is. This number is especially high amongst male. Wait, what? Okay. The study looked at the data from around the country via the National Violent Death Reporting System from 2011 to 2022. According to the findings, was 21% increase in the likelihood of pharmacists will die by suicide than people in the general populace. The number is especially elevated amongst male pharmacists, 25% risk
Female.
high. It says male.
Female pharmacists have a comparable risk to women in the general population. Oh, there we go. Yeah.
The number is especially elevated among male pharmacists, 24% higher than the suicide than what the heck? Why does it male men than men? In general, then men, like men in general.
Other men, other
Yeah. While female pharmacies have a comparable risk to women in general population. Although pharmacy technicians overall have about 14% lower risks of suicide than female pharmacists,
technicians
have 22% risk of suicide than
higher risk of suicide of women in general population.
Okay, so it sounds like men are higher, Liz.
Males count 70%. Yeah, we don't have a lot of male population in ours. Females are higher though. While females account for 24% and 61% respectively. So 76 for men, and then 39, and then females 24 and 61. So
that would make sense if there's less quote men in the field. So if we'll just say if there's 100 men and 25 of them are gone, that is 25%. But if there's 1,000 women in the field compared to men, and what's 10? 140 are gone, that's more. There's more females. The percentage is only 14, but there's more females as numbers.
Yeah, there's a lot more females than
anyways,
I work with a few men, but like there's not a lot of them. So.
But anyways, overall, that's just still overall double digits. Then you're the general populace, right?
Yeah.
So
it's.
And I don't. Okay,
crazy.
you can state this or not. We can cut it. It's your from this point on. But like I said, this is a field that you are in. You talk with people. Has this been a topic of discussion in your group? And is there anything that you have heard from these discussions that you would like to speak about?
Briefly talked about between two female pharmacy people, but it was not brought up after that. So I don't know if people were. I mean, it's been a crazy, weird week this week alone when this article came out, and so it really did. It did touch a little bit of me because it felt like I've been in those holes, and it's hard. It's dark sometimes, and I've talked to you about that. The dark holes that I have been in, and I feel like I give so much and a lot, and sometimes I have to draw myself back, but sometimes it's hard. Because you're like, oh, I worry about that next patient. That patient has been here for a couple months now, and when you think about all these little things that go through our head, nobody thinks about that. We think about these little things, but we do. We talk about it all the time. We talk about that this patient, that patient, X, Y, and Z. How they doing? Are they feeling better? Are they getting better? Are they able to leave? Or is that when are they going to draw back care because this is not working? They're not coming back. You go just the cycle of this. So I mean it's sad, and I wish it was talked about more. I wish it was brought up, and yes, we technically have resources, but not all the time do we have access to those resources.
True. Okay. You can close this off.
This study doesn't reveal a hidden problem. It confirms a known one. When people are asked to carry impossible responsibility without rest, protection, or support, the damage doesn't always show up loudly. Sometimes it shows up quietly over years until the system's left wondering why the people holding it together can't anymore.
So let us know your thoughts down in the comments. We will be reading them all. If you don't forget to like and subscribe and share this so we can hear more, let people know. If you're watching this on YouTube or if you're on Spotify, don't forget to follow and share. We would like to hear your thoughts on this. So thanks again for listening or watching. Until next time.
Yo, going with KB, surge to 11 with a block in the 95. Live the night, we going, we out, going, we go. Yo, we got bees in the street, secrets on the block, this is jail, TCP, live talking cover. The command with the mic and a bulletproof vest, reporting live from a scene that's a hot mess. Each umbrella fly